Again, I'm Dr. Max Malik, and this is Dr. Michelle Hutchinson. Do you want to say a little bit about, introduce yourself, Michelle, and I'll say a little bit about myself?
Hey, I'm Dr. Michelle Hutchinson. I'm a consultant psychiatrist in old age psychiatry. I've been a consultant for about 8 years. Yeah, welcome for coming today. I said I'm really pleased people have joined us because I know it's very warm and children are off school. So I really appreciate people taking the time out to join us today.
Absolutely. Thank you, everyone, for joining. I'm Dr. Max Malik. I'm a consultant psychiatrist. I have experience in general adult psychiatry and older age psychiatry as well. I won't say how many years I've been a doctor. It's a very long time.
Don't
The
make a
hair
thing
really
Max.
giving it away. But many more years still to come. So hopefully, the topic today, Michelle. Thanks for coming and thanks again to everybody. But the topic today is sleep matters. And I suppose the best way to kind of introduce and talk about it is, does sleep matter? What do you think, Michelle?
Well, I think it's hugely, important. I think the recent warm weather has demonstrated an example of that, hasn't it? The fact that it's very warm, people are sleeping poorly. I don't know about you, Max, but I'm certainly more irritable. I'm probably struggling with a bit of a concentration today. So I think sleep is incredibly important. And in clinic, I see a lot of people come in with sleep disturbance. And I'm sure it's the same for general adult psychiatry. But actually, a lot of my clinic time is spent on discussing sleep problems, sleep hygiene, REM sleep disorders. So it's incredibly important to people, and it really impacts on their quality of life as well.
There's already a lot there, but absolutely, I think this week at work, working in an NHS hospital, being in an office, and look, and the window does open, but the temperature is really high, and I think my concentration level and sleep level have been probably even worse than normal. But importantly, there, Michelle, you've touched on a lot of subjects, a lot of potential topics already, which are really interesting to all of us. And I don't think you have to be a psychiatrist or necessarily suffer from any officially psychiatric disorders such for sleep to be an issue. It's an issue for many millions of people actually, I would say across the world. It's an issue for of course for children, but it's an issue for adults and especially for older adults. From my perspective, what I would say is I think it's one of the most common problems and under-recognized still. And I would say actually, interestingly, poorly understood, not just by the general public, but I would say even by
No,
doctors. I think it's one of the best examples of something that's so important, but yet so poorly understood. And if I may say, really poorly treated and managed in some cases. I don't mean just medication, but all of us as general human beings going about our busy and stressful lives, we don't really understand sleep. And one of the questions I'd like to ask you is, and you're a specialist, you're a consultant, older adult psychiatrist. Do you think that sleep changes as we age? Is that something that does happen in your experience?
Yeah, it's pretty common. Oh, sorry, I can see a hand going up. We will have time for questions at the end, but thank you for being very curious. But we'll probably talk for about 20 minutes, and then in the last 20 minutes, we'll be answering questions. So sorry, we didn't clarify that at the beginning.
No,
Um,
that's that's brilliant that people have got questions, but we'll come to you if we may, just in a few minutes. About 20, as Dr. Michelle said. Sorry, Michelle Cara.
That's okay. So yeah, I mean, we see, as you said, we see sleep problems across the ages. In older adults, people are definitely more prone, and the reason is that people tend to have less deep sleep as they get older, more likely to wake up in the night. So often, people just naturally, or if they need to go to the toilet or pain, so they have more nighttime awakenings. And often they have a bit of a change in sleep wake cycle, so they have a tendency to wake up earlier. So all of those really impact on people, well, any ages, but particularly as they become older.
Mm, really interesting. And I've noticed that not only with older patients that I've seen, people have seen, but talking to younger people. And although sleep and insomnia, we can call it, or sleep difficulties are across the board, I think they're so if I look at the figures, it's about 15% of people have what we call chronic insomnia. Chronic simply means it's lasted a long time, you know, and
Like two,
it
three
means it's
months
going on for
max, 2 or 3. I mean, the definitions do vary. But it's
about
normally
3 months. It's
yeah.
about, so the definition is something along the lines of 3 nights of disrupted sleep in a week for about 3 months. So that's an approximation. And interestingly, in our psychiatric classification, there is a new thing called insomnia disorder. But what I wanted to just quickly say that it's common across general populations who may have not been, you don't have to be diagnosed with anything, is what I'm saying, to have sleep difficulties. And in fact, it's around 15%, let's say, in the general population. But those people who have sometimes had psychological, psychiatric difficulties, it's much more common. And that can be anything from anxiety, depression, bipolar disorder, schizophrenia, all the way up through the whole spectrum of the psychiatric range. Of course, dementia, and we'll come on to memory difficulties and sleep. But I just want to say that it's incredibly common actually, and it's one of the pillars of mental health and well-being. If we don't, and as I think you, and this is more thinking about ourselves as doctors, I think if we don't address sleep or advise people at least, and not everybody needs medication, that's the first thing. I think we will probably, onto medication. But I think it's important to say that sleep and sleep hygiene and good quality sleep is so essential to our well-being. Even if we don't have any contact with psychiatric stuff, that's fine. But sleep is so crucial; it cannot be overstated how crucial it really is to us. What do you think about measures like sleep hygiene? And is that something you utilize, Dr. Michelle?
Very, very commonly, but sorry, Matt, just to backpedal a little bit about the link that we used to separate. We separate sleep disorder more into, primary, secondary. Is it secondary to a mental health problem, or is it primarily a problem, which
Mm.
we don't necessarily do now. And I think we recognise that sleep can predispose people to having mental health problems as well. So often can be a precipitating factor for depression, bipolar disorder, anxiety, and the
Yeah.
other way around if you have those conditions. But yeah, so
It's a
we
bi-directional thing, isn't
it
it? Work
is,
both ways.
yes,
That's what
yeah.
I think
Um,
is so important. Yeah. Sorry.
but it's no, it's okay. Sorry, but it's very important to treat because we know, for example, if we treat insomnia with CBT for insomnia, actually that can improve outcomes in depression. So just to go show what impact it is having on people's mental health. But the fact that it is related often to mental health problems, not all the time, that we do spend a lot of time in clinics talking about it and talking about sleep hygiene. Now, I have to say, if someone's got good going insomnia, probably sleep hygiene might not be enough. But
Mhm.
we know simple measures are probably first line, what you would try. So, and it's amazing. I'm always surprised when I try and advise people about this, that how little is known about basic sleep hygiene, not drinking too many fluids at night, not having coffee in the afternoon, not drinking alcohol at night, having a shower or bath about an hour before bed, because that temperature change, that drop, helps people get off to sleep, not using their phones, because we know that blue light is absolutely terrible for sleep. Actually, that people are not aware of very basic things.
We're all guilty of that. I
I
put
mean,
my
yeah,
hand up.
just don't. I mean, take our advice, but it's one of those things. Don't do what we say, not what we do, as doctors.
Yeah, we
Um,
try and
but they
implement
can
these
make a
things.
difference,
Yeah,
and
sorry,
particularly early
absolutely.
on.
Absolutely. So, yeah, all those brilliant things you said. But I think looking at some of the research, one of the most important things is maintaining a waking time. And one of the evidence-based things is if you try to wake up, that it is, at the same time every day. So I know this isn't possible for shift workers, new parents, a lot of other people in different jobs, etc. And so, but generally speaking, if somebody has difficulty with sleep, one of the best things, there are many things, as you mentioned, we can go into each of those, but two things I'd like to say on what you said, response to what you said. One is sleep hygiene isn't enough for everyone. So it's not just a case of guilt or blame or saying, oh, you haven't done all the right things. Sometimes even doing all the right things, and then you need specialist advice.
Yeah.
And it could be your GP, could be a psychiatrist, could be sleep for really serious things. The sleep clinics are around, although they're not very common. But this idea of waking up I've found now over many years of habit, if I don't set an alarm, I'm still going to wake up around about approximately the same time. And I think that has been shown to wake at even if you're off. And particularly, I say this for students and younger people who it's very easy. I think it's easier for teenagers and people in their younger 20s, let's say, to sleep, and then somebody of my age, in the 50s, to sleep in is harder. But I would say if you want to maintain good sleep hygiene, resist that temptation to sleep until midday or whatever, because waking up in the morning at the same time, that regulates patterns in our brain, and we can come on to what drives sleep later. But do you want to say anything regarding patterns of sleep, Michelle?
Well, just to reiterate really what you said. So yeah, again, we talk about, well, our bodies are based on patterns. That's the whole problem with modern life, isn't it? Our brains and our bodies are built for caveman times and not modern times, which is filled, we're sitting on chairs all day, we're not burning off calories or using energy, we've got blue light with all these screens, and it really disrupts sleep. So very, very important. And we know that women generally need a little bit more sleep than men, and
I knew
generally,
you were going to say that, Michelle.
yeah. Of course I am, Max, as the
I knew that
female
was going to come up
generally
somewhere.
psychiatrist. And they need to tend to go to bed a bit earlier, actually. Their natural circadian cycle is to go sleep a little bit earlier. So yes, it's very, very important, Max. But often these things are helpful, and if insomnia is not well established, if someone's just recently developed insomnia, those measures can help.
Mm,
It's a
mm.
little bit, I would say it's probably less helpful when someone's had it a few months and there's good going reasons why, but
Yeah.
certainly in the first instance they can really help.
Absolutely. And I think that's the important thing. It's a two-way dynamic process. So what happens when we don't sleep very well? We can become obviously tired in the day. We can have that temptation to fall asleep. The less you sleep, the more the drive is to sleep. That can make us anxious sometimes. It's a bit of a cycle. Then we might drink coffee to keep ourselves awake or perk us up. I know I do that in the mornings. Things uh like if somebody is suffering from difficulties such as anxiety, depression, things like irritability, even things like emotion, you'd be surprised. Well, perhaps I was surprised to learn to the degree that things like emotional regulation or dysregulation can be affected. And of course, sleep is when we lay down our memories. It's when we consolidate our memories. Lots of things happen when we sleep. We can argue as to why we need to sleep, but the fact is we do need to sleep. We need to clear our brains of toxins, and we need to sleep, and we need to repair certain things within the brain, and lots of chemicals and neurotransmitters are involved, which we can go into if anyone's interested. But sleep is necessary. So this idea that okay, perhaps women need a bit more sleep or sleep a bit earlier, possibly. But one question, do you think, is that this idea that we were brought up with this idea of we must all have this 8 hours, so we sleep at 12 and we wake up at 8 and bang, and it's like that. Do you think is there any, I mean, what do you think about that idea, Dr.
I mean,
Michelle?
if you look on, average, it's about, the ideal time is probably 7, 8 hours of sleep for most people, but we know there's huge variation. So I think Margaret Thatcher very famously managed
Yeah,
on about 4 hours, and
yes, she
obviously
did.
around the
Yeah,
country.
yeah.
So it does vary between people. What we do know is too little sleep. So you can't really base it on an individual basis, but we know that people who have sleep problems, sleep less, probably at high risk of dementia, mental health difficulties, physical health problems. We know that insomnia is associated with things like heart failure and heart problems. And we know actually the same is that if people sleep too much. So often when I see people in memory clinic and they've got a memory problem, it's associated with too much sleep. So what I'd say is don't get too caught up on the number. It's probably more important, is it quality sleep? Are you feeling refreshed in the morning? Can you function in the day? But those
Mm.
are important rather than getting stuck on sleeping the perfect amount of time.
I agree with that, and I do want it. You mentioned sleeping too much, and that can be sometimes a
Yeah.
problem. So, if we are to give people a number, I personally would say somewhere between 7 and 9 hours. If that's and of course that's an approximation. Some people do get away with 5, 6. Some people get away with need 8, 9, whatever. But if, for example, if somebody comes to me as a psychiatrist and says, "Oh, I'm sleeping, in the day and the night. I'm sleeping an average of 14 hours, 16 hours a day," I would know that that's probably not quite normal. There's something going on that I need to explore more. And there is, there are certain conditions in which people sleep more, which are related to difficulties with mental health, such as, for example, atypical depression. This idea, such as some dementias, some slowing down of cognitive function associated with sleep. I want to, before, because time, I'm aware of the time, but I just want to come on to a couple of really important things, such as, uh, people worry that if I don't sleep, then does that mean I've got mental health? And some mental health difficulties are associated with lack of sleep. For example, famously and probably generally, people are aware of this when people become manic, or there's a lack of sleep generally and sleep disruption in things like bipolar disorder, in many disorders, but for example bipolar disorder. This is a particularly famous one when people have suffer from hypomania or mania, then sleep disruption is when what we call a psychiatrist as a relapse signature. And sleep can actually, according to the evidence, be one of the very early relapse signatures, sometimes days before an episode of relapse in mental health difficulties. Sleep architecture and sleep can be broken down. Is this something that you think is important for us to identify earlier on? And how does sleep architectural breakdown of these relapse signatures sort of relate, in your experience, to things like bipolar, but also older adult health and memory difficulties? How does that work, Michelle?
Oh gosh, that's a really big question. That's another 20 minutes on its own, Max. Just to dissect a little bit, we know that poor sleep, I said, is possibly increases the risk of dementia. Is not entirely clear because some evidence suggests it's the other way around, that it could be the first sign of having a cognitive problem. But we know that when you sleep, I think you've alluded to this already, that your brain is trying to clear out. It's a restorative process. And your brain is trying to clear out proteins in the brain which can build up and contribute towards dementia. So yes, it can certainly be related. Not the full story, but
If I don't sleep well, am I going to get dementia, Dr. Michelle?
Uh, well, unlikely. But as with many conditions, it's not one thing which is causative. It's very rare, isn't it, in our job? There's one thing causative. It's that the risk is increased by, you might have a genetic predisposition, lifestyle factors, sleep, poor hearing, and all those things build up. So it's never one thing in our job. It's all things that build
It's
up.
absolutely. So it's this idea of multifactorial, and there are in this multifactorial causative agents or causes of, for example, let's take memory difficulties or dementia, or anything. Cardiometabolic health is another thing that is affected by sleep. What we can do, there are things that we can modify and things we can't modify. I can't modify the genes I was born with. That's all my parents' fault, nothing to do with me. But I can modify my weight, my exercise, my diet, and my sleep. But I think I want to go back a little bit before we end to this idea that if it's chronic, meaning if it's over 3 months long and it's for 3 nights or more in a week, that's kind of the definition, broad definition of insomnia disorder within our new ICD-11. And if people are interested, we can talk more. But now I want to talk because people are buying lots of stuff out there over the counter. The GPs are prescribing stuff. Psychiatrists and other people are, are talking about sleep promotion. And I've seen these videos on YouTube. I'll fall asleep like a Marine within 3 minutes, or not quite your money back, but the idea is fall asleep with it. And I can never fall asleep within 3 minutes. I mean, that would be a miracle. So I don't know. What do you think about evidence-based? Let's talk scientifically because we are scientists as doctors, and let's talk about evidence-based. What's good? We've talked a little bit about sleep hygiene, and those are things that people can easily look up. But I think things that get confusing, where we can particularly come in, is give clinical evidence base for if people do need help with sleep and they really must take something, what kind of safety measures, what's good, what's not good, what's
Yeah.
safe for people to do and not do, would you say? In your
So it's again very dependent on where you live and what's available to you, and also on the individual. What I would say is, in many places, the first line treatment for insomnia isn't necessarily medication, although that tends to be what's available. It's insomnia, CBT. So out of all the therapies in mental health, it's actually got one of the best evidence bases. It's fantastic. And when I read the evidence, I'm like, why is this not available everywhere? Because insomnia affects everyone. And if we can treat it without medication, brill.
Absolutely.
Unfortunately, even though the evidence base is fantastic, practically, I mean, I've got a gentleman I saw today, Max, in clinic, and he really could benefit from insomnia CBT. But I was thinking, actually, I'm not sure if I can access it. But I said, I'll look into it for you. He's very keen on it, actually.
Yeah.
Um, and that's incredibly helpful. And again, that's sleep hygiene, but a little bit more. So it tries to challenge those negative cognitions, which kind of perpetuate poor sleep. I know you're kind of almost on a sleep regime. They ask you not to lay in bed if you're awake for more than 20 minutes. You have to get up until you feel sleepy again, so that you learn to associate your bedroom with being sleepy rather than feeling distressed or anxious.
Mhm.
So I would just to home that, because I think often we see people who understandably want to come in and have a tablet to help, and we know that's quick and it's not always easy to access things like psychological therapy. But that's one thing I just really wanted to highlight, because as I said, the evidence base is very, very good. Medication, incredibly broad, very much dependent on the individual, but we know that um, you know it really affects people's quality of life, and sometimes medication is necessary.
And actually, sorry to just jump in there, but it actually can affect your longevity of life, your physical health in that life, and your,
Hugely,
of course, your mental health.
hugely.
But I want to just to mention a bit more about CBTI,
Mhm.
which is the CBT for insomnia. Now, we as human beings want the quick and easy answer. Here's a tablet. There you go. Off you go. You're going to sleep well. It doesn't always work like that, because not all tablets, not all prescription medicines suit everyone. Number one, they do have difficulties associated, as well as side effects such as dependence, which is related to people commonly call addiction, and there's tolerance effects, which means you need a higher dose for the same effect. But CBTI for cognitive behavioral therapy for insomnia. If you can get this in person, fantastic. But I do want to mention, as a health promotion tool, that people can access this online and as an app, in fact. And it's called Sleepio, and it's available if you put your NHS number in. It's free if you put your NHS number in, and it has helped numerous people. And as Dr. Michelle was saying, this CBTI is actually incredible, even in people who have had chronic, what you would call severe insomnia for months, years. If you put yourself through this program, even on the app called Sleepio, and you can download it from, all the app stores. You have to put your NHS number in to get it free, but otherwise, I think there's a paid version. And this app and this CBTI has been proven to be amazingly efficacious, efficient at helping us to improve our sleep. And I think the results show around 70 to 80% improvement, which is amazing, because I promise you there are
Yeah,
very few medicines out there in
nothing matches.
psychiatry, or, not even psychiatry, in general medicine.
Yeah.
And we can look at the research and say that there very few things can match that. So,
Mm.
even in chronic, it takes time, it's harder work, but the longer term effects are much more beneficial than popping a pill. Talking of pills, first of all, can I quickly just mention there are lots of herbal things out there, and I would say to people, my general advice to patients: look, herbal things, if not everything herbal is safe, number one, and not everything herbal suits everyone. That's the other thing. So lots of herbal things, depending on where you source them from, can be dangerous, can be toxic, can be damaging, may interact with the other medications. So be careful. Herbal doesn't always mean safe. Number one. Number two, if people were going to consider medications. And I know that a lot nowadays you can buy a lot of even prescription medications, which are prescription in the UK. You can buy them online. What would be your advice, Dr. Michelle, about those kind of medications?
Was you thinking more about not what well, it's not herbal, is it? But it's not necessarily a medicine in most countries, which is magnesium, or was you thinking of melatonin?
So I was thinking of both
So
magnesium
is
and
it needs
melatonin. So
melatonin? Okay. So I was wondering where you was going with the M's.
yeah, what do you think
Um,
about magnesium or melatonin?
okay.
Because these are commonly available.
Any M, any
I
M.
mentioned these two because they're really easily available online. You can
Yes.
just
Yeah.
buy them like in America, they're actually a food supplement. Melatonin is classified,
Oh,
but
you
in
can,
you can just get it from a chemist. In UK, we have to prescribe it. Well, depending if you go online. But should we take both of these? Because these are, I think, one of the most commonest groups.
yeah.
Yeah.
So, magnesium, I'm seeing, I don't know if it's just me, Max, I'm sure it's for many people, but I'm seeing lots of adverts online. So obviously I must have Googled something about sleep, struggling with sleep. So I'm getting all these adverts. And it would, again, lovely to think of something which isn't a medicine, um, but we can take it. But the evidence base from my knowledge is not very good. And again, from clinical experience from people who taking magnesium, not brilliant. So it's unlikely to be harmful. You know, if you take huge amounts, you can get diarrhea, but generally it's safe. You know, if it helps you feel that you're doing something, that's positive.
Yeah.
Melatonin is, well, I suppose a lot in some groups we know it can be effective. You know, it's licensed generally in the extremes of age group, younger people, older people. But it's actually the mechanism it works is it tries to right the sleep wake cycle. So it's helpful in certain conditions like jet lag, for example, you can prescribe it for jet lag. But if there's other reasons driving the insomnia, like anxiety, mental health problem, it's probably not going to be the answer. And in cases that I see people with memory problems, for example, it doesn't tend to work, and I think the evidence base isn't there. But it might be slightly different for general adults, Max.
So I think in the UK, according to our licensing and the British National Formulary, which we follow as a guideline, it's for over 55s, it's for jet lag, it's for particularly conditions where, for example, children with autism. Although in other countries it's used much more extensively. It's some evidence base in some people with ADHD. It can help. And people, as I say, use it as over the counter in some countries. It's unlikely to be as harmful as some other things, although there are cautions with it. I mean, for example, one of the cautions that often people don't realize, things like autoimmune conditions, you have to be caught. Melatonin is not recommended. There's a variety of autoimmune conditions that, things like thyroid and amongst others. Thyroid is probably the most common autoimmune condition. So I think melatonin can be helpful in some scenarios. Again, we do need medical advice before we start using melatonin in my opinion. And that's what we do in the UK. We don't just give it to everyone. Then there are the other groups, the traditional sleeping tablets.
Really, just to remind you, Max, that we've run over time,
Okay.
so should we make this
Perhaps
the
that'll be
last
one of
point?
our questions. Let's make this the last point. What do you think about sleeping tablets? Because I think it's a big topic, and a lot of people, millions of sleeping tablets are prescribed. Let's stick to the UK. In the UK, every year, literally millions of different groups, and they come within different categories. But let's have a quick, in your opinion, what do you feel about sleeping tablets for insomnia disorder?
Well, I think if it's gone on for 3 months, as I said, we know it can have significant impacts on people's physical and mental health. Maybe, CBT is not available, or maybe for whatever reason you're not able to access it. So you can use it even if you have mental health conditions, but there are a few exclusion criteria. Then actually medication is appropriate. What medication you have is slightly independent on the individual. So, for example, in older adults, we steer clear of benzos. We can prescribe things like
What are benzos, Michelle? Would you mind just
sorry, yeah, it's just
just explain what does
benzodiazepines
that
like
mean?
temazepam. So I don't think we use them so much in psychiatry. I think GPs probably use them more. But we know, for example, particularly in the age group I work with, it increases the risk of falls, can make people a bit confused. For that reason, there's some newer sleeping tablets on the market, like Doxorant. I don't know if you've used that a lot, Max. The
Yeah, I've
newer,
used Harry Direxent.
yeah,
So we can yeah, I agree with
yeah.
your summary. So there are different groups. There are traditional, what we call benzodiazepines, which are traditional sleeping tablets that people were prescribed, like temazepam in the old days was used
Yeah.
much more frequently, diazepam, etc. There are a group of drugs related to those called Z drugs, and they come under the, like, for example, zopiclone, zolpidem, just to name two examples. They're related, but not quite the same. And there's overlap between those. Now there's this new group which are called orexin inhibitors, which are like daridorexant, which you said. The excitement around those is they really help some people sleep, and they're not as addictive, if you like, or tolerance forming or dependence forming as some of the older drugs. So daridorexant, if it helps you or some people, or if your doctor has prescribed this, obviously it's a prescription only medicine, and there are two doses available, whereas previously there was one. But daridorexant can be helpful. I have used it in general
Yeah.
adult and in fact old adult psychiatry, and it does help some people. So so just a quick summary, and we've got questions coming in, so we're gonna deal with those. But
I will be
if
going like this, Max.
it's
Yeah.
lifestyle, yeah. So as we've covered, it's a lifestyle thing, and it's not just about you're not tired enough to go to sleep, which used to be the old-fashioned way of thinking. It is a standalone disorder, but it's associated with many difficulties. It's a bi-directional thing, both in mental health, as a sign of difficulties, but can cause difficulties of itself, insomnia. And treating insomnia can help a huge range of psychiatric conditions as well. Uh, Sleep hygiene, and the biggest evidence overwhelmingly is CBT for insomnia. Having said that, if it's severe and it's going on for over 3 months, a really disruptive, particularly affecting your daytime functioning, tiredness, work, family life, socialization, irritability, relationship, all these factors, psychosocial things we look at, then there are medications, but they should be through a doctor or a specialist like a psychiatrist. But even in those cases, I would still come back to the CBT, cognitive behavioral therapy for insomnia. Sleepio is an app which is available. I would recommend anybody's any sleeping disorder download this and try it out and use it regularly. It's actually fantastic. That's a very brief. There's so much we could talk about sleep, and we could talk for all night long, probably. But
Well, that's one way to bore people to fall asleep, Max.
okay, Michelle. So shall we? Right. So Imran asks, I have bipolar and experience increased racing thoughts before bedtime. How do I shut these off so that I can sleep better?
Oh,
That's
so sorry, Max. There's someone else also asking about racing thoughts, but in the context of
okay.
ADHD. But there probably is a bit of overlap we can talk about as
I
well.
think generally, yes. It's a go for it, Dr. Michelle. What would you think? What would
Oh
you
no,
say?
you go first, Max.
So I mean, it's about, so again, let's go back to the basics. So racing thoughts, and then there's another related thing which happens called ruminations, which are repetitive thoughts or unwanted thoughts or intrusive thoughts. So racing thoughts can be, the thoughts are fast, which I understand the person with bipolar is talking about, and that occurs. And you don't always have to be in a high state. You don't always have to have hypomania, mania sometimes for thoughts to be fast or intrusive or keep reoccurring. So there can be worries. Intrusive thoughts literally means thoughts you're not really thinking about, but they come unbidden, if you like, into your mind. That's what intrusive thoughts are. And rumination means you're going over the same things again and again. So that can happen in anxiety, depression, many psychiatric conditions. And I would go back to the basics. Say, look, what's your sleep hygiene like? What are you doing before bedtime? If you're watching exciting TikTok videos and people are dancing and you're stimulated, and also let's not forget, in certain psychological conditions, it's hyperarousal is already a problem. Okay, it's not just in bipolar. One of the issues, for example, in anxiety is that why are we anxious? Because we're hyper-aroused. In PTSD, what's one of the problems, major signs is nightmares and sleep disorder, sleep disturbance, so sleep is very complex. It's the homeostatic drive to sleep, the circadian rhythm, which we briefly touched on only, but there's so much. So I would go back to basics, sleep hygiene. What are you doing before bedtime? Have you got regular bedtime? Are you relaxing? Are you doing any mindfulness? Are you sleeping in a cool, dark room? Are you maintaining a pattern? Are you not eating, drinking alcohol or tea, caffeine, etc. before sleep? Are you doing stimulating activity? So, for example, too much vigorous activity before bedtime as well. People sometimes go for a run. And I know people who want to exercise in the evenings and night, and that's okay if it suits you and you can
We don't need to comment
well,
too much on that, Max.
yeah. And so I would go back to basics, look at lifestyle, look at sleep hygiene, look at sleep patterns. I'd say awaking at the same time every morning, no matter what. So I try to wake up around 6:30 or 7 every single day. If I'm off, then it might be 7. If I'm going to work, it's going to be around 6:30, no matter what I do. That's just how it is. And I maintain that. So the drive then, by the time you get to evening, if you do this consistently, so switching off, mindfulness, relaxation, hot chocolate, Horlicks in the old, do you remember Horlicks? Horlicks in the old days, a malted drink, no tea or alcohol before bed. This sounds silly, but honestly, they're really. What did you say about bath? You said something earlier
No, no,
about.
sorry, just making an inappropriate
No,
joke.
no, but you said something
No,
to be
no. So
helpful.
one thing I was to say that I find particularly helpful, Max. I mean,
Yeah,
I often bleat on about exercise, don't I, Max? And I do a lot of Zumba and yoga, and there's some exercise. Again, this is sometimes a hard sell for people, but there's lots of breathing exercises you can do, muscle relaxation.
exactly.
I went to yoga the other day, and we was taught this exercise to help us sleep about certain hand movements. I wish I could remember it now. So there's lots of things we can do. I often find, because I tend to be quite anxious, and I find it really helpful to write my thoughts down so that I can actually just settle them. Like, they're not, I'm not going to ruminate about. I'm going to write them down. There's nothing I can do tonight. I will write those down. I will deal with them tomorrow. So I personally find that very helpful.
Put it in a box and put it away if possible.
Yeah.
Breathing, muscle relaxant, imagery, and mindfulness. These are some of the ways to switch off racing thoughts. Somebody else is asking here about sleep, where um, about racing thoughts because of ADHD, especially active at night compared to the day. I feel more tired. How do I manage all night and get either 4 hours sleep or none? Or sleep in the day. And again, that comes back to the same things, doesn't it? The switching off, the mindfulness, the activity, reducing blue light, getting your mind ready for sleep. And also, I must say, sleep anxiety. The fact that you don't, this is difficult, and I, know this, but don't allow the fact that you may not sleep stop you. Don't let it worry you to the extent where you're not sleeping. If you're not sleeping, you're in bed, you're lying there, get up, stay in a calm, dark environment, do something else, and then come back and try and sleep again. Nadeem asks, does the amount of sleep you need reduce as you age? You touched on this, Michelle, but you're the specialist.
Yeah, so
How
someone's
you
asking
need
a
in
question
the
about how
50s,
many hours you
in the
need. I mean,
70s? Yeah,
probably
sorry.
below 6 hours or less, you're probably increasing your risk of changes to your physical health, like heart disease. So probably 6 hours is the minimum for good health. Although I said that does vary slightly. The amount of sleep, actually no. You still probably need as much sleep. The difficulty is it's harder to actually obtain the good quality and the amount of sleep you need as you get older, but actually your requirement doesn't change so much. It's just probably more difficult to obtain, but you still need, even if you get older, you probably still need those 7 hours.
I think, yeah, generally, I think it's easier to sleep longer when you're younger. That's what I would say. But your need for sleep, your brain's, for example, metabolic activity, the system in your brain that clears the bad toxins out of your brain and then makes the connections, makes the memories, makes all these neurotransmitters work. And, we might have heard of some of these. So these include things like serotonin, noradrenaline, orexin, in fact, one of the new ones, amongst many, many others. I could go on, but also new connections, memories. Sleep is this incredible thing, and we haven't even touched on things like dreams and nightmares and, all of that. But I don't know. Yeah, maybe we don't need less sleep as we get older, but we certainly find it harder to sleep, maybe. Would you agree?
Yes, yeah. So it's still important. Sorry, someone's just asking a question of unbroken sleep.
Yeah.
We know that's not possible for most people. It's quite natural that people maybe wake up once or twice in a night. So I think that's unrealistic to have unbroken sleep. Um, but minimum of 6 hours in total is
Yeah.
probably what we should be aiming for. Is that always possible? Probably not, but we know
Sorry,
that's
can I just expand on that, the point when Nadeem is asking, is it that 6 hours of unbroken deep sleep
yes,
is
yeah.
necessary? Because I don't know if I've had that in 30 years, he's saying.
Have you had it in a lifetime, Max? I don't
It's
know.
not me personally.
Since you've
Somebody's
been a
actually,
psychiatrist.
maybe a psychiatrist done this to me. But but really, because there's another interesting idea here about two sleeps, because and this is a modern, I must say that this idea of having 6 or 8 hours
Are you
unbroken
talking about
sleep.
medieval times where we'd have
Yeah,
two
there was
separate
an
sleep?
idea where we had two sleeps. So we slept as twilight and dusk came in, people went to sleep. Then they woke up, maybe around midnight or just after, and stayed awake for a while, or did, I don't know, and then went back to sleep. And then there was this two sleep. So the idea that you must have 6 or 8 hours of absolutely unbroken sleep. But I do get the concept of deep sleep, because I think what that's alluding to is quality of sleep. And I think what that's alluding to is waking up feeling refreshed, because I think that's because people sometimes say, "Oh, you know what? Even when I get up and I'm tired in the morning, I'm tired at lunchtime, I'm tired in the afternoon, I'm tired all the time." And that is one of the key indicators, as we know, Dr. Michelle, in psychiatry. Somebody tells you, "I don't sleep, I'm tired all the time, I'm worrying all the time." These are some of the key kind of indicators that we see across many different psychiatric conditions. Would you agree with that?
Or sleep apnea, I have to say, or people have problems with quality sleep. So I've seen someone in clinic today came in with no, sorry, this week, who came in for a memory difficulty, and I assessed her, and I was like, actually, I think you've got sleep apnea. So
Yeah.
the problem seemed to be more of concentration. Her partner complained about how much she snored.
So
She
what,
didn't
sorry, what, Dr. Michelle, what is sleep apnea? What is
Sorry,
that?
I'm just aware we're overrunning. We're going to be kicked out at some point. But yeah, so sleep apnea is basically a difficulty getting enough oxygen in when you sleep. It's often related to people being overweight or lifestyle factors such as alcohol, particularly if they've got a wide neck and they carry the weight here. So basically, it's a problem with getting enough air in with your airway. And this often presents with not so much memory problems, but attentional problems, and feeling sleepy in the daytime. So when someone says to me, "Gosh, if I just sit there and I go like this, I fall asleep," instantly I think, "Has this person got sleep apnea?" And there's a very quick scale you can do, and I did that with this lady in clinic, which is it only took 5 minutes, if that, where you just rate how sleepy you are in certain situations. If you're sitting in a stationary car, if you're sitting down watching TV, and it just flags up, really gives you a little scale, how much you sleep in a daytime, and it might prompt, say, referral to a sleep
I
clinic for
think I
further
think that's
investigation.
an excellent summary, and it's sleep apnea is more common again than we realize. It
Very
is to
common.
do with weight. It is to do with centripetal obesity. It is related to things like alcohol and lifestyle, and amongst other things, but not solely and always. That's what I would like to say. It's not just people with weight issues. It can be seriously, we need to consider it across the board. Interestingly, Wakar just asked a question of, do I need to sleep all these hours continuously? Can they be broken up? So what I would like to say to that is, and we haven't had time to, I think it's such a big topic, but sleep has, there's such a thing called sleep architecture. Sleep is broken down into different segments and it's been very well studied. We have lots and lots of research on sleep. So, you have things like NREM sleep, REM sleep, slow wave sleep, different aspects of sleep, which go through, and we haven't even gone on to REM behavioral disturbance and things, which is one of your specialities. I know, Dr. Michelle.
Again, I could just spend an hour
We're
rambling
just talking about that.
about.
But what I would like to answer the question
Yeah.
about to Wakar is, if you don't sleep for a certain number of hours continuously, or more or less continuously, you won't have the sleep architecture. That is one of the main reasons why people wake up feeling not refreshed. Because what's happened is the broken sleep has come in, like in sleep apnea. So your brain hasn't had time to go through all these cycles. And we can actually see these cycles on, for example, EEG measurements and traces, and other ways, polysomnography, and there's lots of other ways of measuring. And there are sleep clinics which actually watch you sleep and they measure your sleep in different ways. So there's lots of different aspects to sleep, different cycles, different. Your brain has to go through different levels of activity. It at that level, it's scientific and complex. But just to know, for example, if somebody says, "I sleep 2 hours, I wake 2 hours, I sleep not again for another 4 hours, and I snap in the day, that's not going to cover it.
Oh,
That's
oh, napping is
our,
my, I
yeah,
mean, yeah,
that's my
yes,
recovery. If you nap on recovery, the evidence shows you're probably not going to sleep so well at night.
yeah.
And sometimes I get it. The need to nap is overwhelming, because again, those drivers in our brain, those mechanisms are making us and so it's complex. So there are physical drivers, neurochemical drivers, there are psychological drivers, there are social drivers, there are things we put in our body drivers, to keep ourselves awake or make us sleep. So all these things is a very complex interaction. But the good, I would like to kind of go towards wrapping up on a good news is that there is treatment is possible, even in chronic severe cases. And we know that the evidence base, and this has been researched massively, and is CBT, cognitive behavioral therapy, which stands for insomnia. So
So can I
that's
check with
specific to
you,
insomnia. Yeah,
Max?
yeah,
Is that something we can maybe check with our psychologist? Because I think
yeah.
she's doing the next session on CBT. If it's something some people are interested, I wonder if she can touch upon that in a bit more detail in the next webinar. We can ask.
Mm. Yes, absolutely. I think that's something we can bring in our psychologist, Natalie, you're thinking of, is that right?
Yes.
Is that, yeah, we can bring Natalie in our next. One of the questions from Hajra is how do you
Oh,
stop
I'm sorry. I
Yeah,
think
we've
in
run
a
out
moment
of
we're going to
time.
have a big
Have we
cane
run out of
to drag
time?
us away.
Okay. Well, we've had some good feedback and some excellent comments, and I'd like to thank everybody who's participated and commented and asked questions. And obviously, these are hopefully educational and useful seminars, not seminars, webinars for people. And there is so much we could go into. But if people do have specific questions, like us to help more or answer some questions, whether they're specific to difficulty, whether sleep or mental health, well-being, or anything else for that matter, we do have a range of specialists available to us, luckily, and we can hopefully help to improve people's not only sleep but general quality of life, well-being. That's what it's all about. That's why we do this job. That's what it's about for us, is job satisfaction through helping people improve quality of life. And if we can do that or help you think about ways to do that, then I think it would have been an hour worthwhile and well spent, in my humble opinion. Anything else you'd like to add before we sign off, Dr. Michelle?
Well, no, thank you for everyone for being here today. A few people have kind of commented on sleeping problems and ADHD, and maybe that's something that we can think about
I think that's
covering
a
in
topic in
another
it.
time. Yeah,
ADHD and ASD are very big topics, and
yeah,
huge numbers of people, and they have their own particular challenges. And it would like to discuss this if people are interested, and
yeah.
things like sleep, concentration, learning in ADHD further, and even in ASD, which is autism spectrum disorder.
Oh, that's
I mean, we're
interesting.
using abbreviations, but I'm assuming that people know these common abbreviations. But if anyone doesn't understand what please do say. But yeah, if anybody would like to suggest particular topic, we have got a list of topics. But if there's something you're particularly interested in, such as ADHD and sleep, for example, how to improve quality of life in these particular conditions, then more than happy to help if we can.
All right,
Thank
thank
you
you
very
very
much,
much, everyone.
everybody.
We'll let you
Everybody,
escape and have
great,
a cool drink.
everybody.
Would probably be a good
And please
idea.
join us the next time, and we'll publicize the date of our next webinar. Thanks very much, everyone. Take care. All the
Thank
best.
you.
Bye bye.